Hi, good morning. I am Dr. Dillon, Pushpender Dillon. I'm a board certified OBGYN, practicing clinical medicine for 21 years now. I've taken care of thousands of women during pregnancy, postpartum, during menopause, and before starting a family. So today we are going to talk about women's health, specifically after age 30. And the topic is breaking the silence about women's health after age 30. Next slide, please. So, whenever I see patients after age 30, it is told to them that having leakage of urine, that means you pee on yourself after you have a baby, maybe immediately after baby, which is actually normal for a few weeks, but not at least 6 weeks postpartum. But to continue to have these symptoms when a woman is coughing or sneezing, or she's just having good time with her friends after a glass of wine, she sneezes and she just leaks urine. It's told, oh, now that you're a mom, this is normal. Or now that you're in your 30s, this is normal. Same thing, pain with intimacy, pain with sexual intercourse. Oh, it's normal, especially after 40s and 50s. Also, feeling tired all the time, even if you're not working, or even if you didn't go exercise or hiking, but you were just home and you start to have chronic fatigue or feeling tired all the time. Or why are all these things happening suddenly after age 30? This is not something, which is normal. Yes, we see it in patients all the time, but let's talk about why this happens and what can be done. So this, I just want to make sure we know this seminar is judgment free. We are not trying to say, oh, this is why this is only happening to certain patients, but we're trying to have a grounded conversation. So please feel free to ask questions, and I will try my best to answer them based on the evidence and the medicine that I have learned in last 20 years. So what are women told when they have these symptoms? They are told, oh, it's just aging. You're getting old. They're also told, oh, after 30, your hormones start to go down, or especially in menopause or perimenopause. Or my favorite, that's a part of motherhood. Well, no, it's not. It's not a part of motherhood that once a woman has children, that she's supposed to have these symptoms. But medicine has advanced a lot. Even since I started practicing medicine, we now understand these conditions. We actually understand what is the pathophysiology, or what is normal, what's not normal, and what can be done to actually treat these symptoms. So let's initially start with, what are my goals today? We are going to clearly describe these symptoms. We are going to try to understand the medical background or the medical basis for these symptoms, and what are the real options that patients have. We as women do not have to tolerate these symptoms silently over years and years of our life, and especially not talk about them. And what we are trying to achieve here is not that we're trying to, we're not chasing youth here. We are trying to restore the functional capability of a woman's body. So let's talk about what happens when a woman is in her 30s, 40s, or 50s. What are normal changes? What are changes which are predictable? Now, what is happening there is not a personal failure. Patients think, oh my God, I used to feel this great or look this great when I was in my 20s, and here I'm in my 40s. I just have to suffer because I'm old. No, that's not the case. And this is not a personal failure. Let's talk about physiological shifts that happens as we as women age from our 30s to 40s and then to 50s. What are the normal physiologic changes? So starting with the support of the pelvic floor. If a woman has children, whether it's one, two, or three, whether it's a vaginal birth or a cesarean section, there are a lot of changes which can happen to the pelvic floor, which are pregnancy effects. And there are a lot of well done studies. Actually, they did MRI studies where they showed a pre pregnancy pelvic floor and then pelvic floor after childbirth. And they even compared vaginal birth versus a cesarean section. So we know that once a woman has a child, the pelvic floor is not the same. There are physiological changes which happen to the pelvic floor. And there are some of these changes are reversible and some are not. For example, damage to the small fibers of the muscles are not reversible, but some of them are reversible. So let's take one organ at a time and talk about it. So the first organ affected is bladder. Bladder in a female body does not have a very strong support in the pelvic floor, and that leads to symptoms of urinary incontinence as we get older, especially after childbirth. Uterus is held in the pelvic organs by two very thin ligaments. So if you take my pinky and cut it in four, that's how thin those ligaments are. And they don't get much bigger or stronger during pregnancy. So after the delivery of the baby, the uterus has a tendency to actually come down, and that's what we call it uterine prolapse. We see it all the time in patients in their 30s, 40s, and 50s. The bowel is an intrapelvic or intraperitoneal organ. The bowel is sitting, and when we stand up, it's our pelvic floor which supports the bowel. But as the pelvic floor gets weaker, the bowel can come down and feel like a bulge in the vaginal area. I hear that from patients all the time. I feel this bulge in my vaginal area. That's all the organs of the pelvic floor are coming down because the pelvic floor is not that strong anymore. And why is that? Why is that? So I told you one of the reasons is pregnancy. Carrying a baby throughout the pregnancy, whether it's 7, 8, 9, hopefully not 10 or 11 pounds, can lead to weakening of the pelvic floor. Hormonal changes, we used to think, yes, hormone changes in 40s and 50s, but now more and more studies actually show the hormones for a female hormone, especially estrogen, progesterone, and some data on testosterone actually start to go down as early as in our 30s. So that leads to prolapse or of these organs and weakening of the pelvic floor. Definitely aging plays a role. As we age, it's not just the skeletal muscles, which is the bigger muscles of your arms and your legs, which are getting weaker. It's also the pelvic floor. Also chronic pressure from the internal organs, where pregnancy plays a role. There was some data earlier which showed that constipation increases pelvic organ prolapse, but new studies actually show it does not. But there is some controversial data about it. So what are the symptoms which after the weakening, after this organ prolapse, what it actually leads to? What are my patients feeling, or every woman or many women feel, is leakage of urine, a lot of pelvic pressure, reduced sensation during intimacy. What is pelvic floor? Pelvic floor, if you look at actually specimens, or if when you're a surgeon, we see actually this, the pelvic floor is a very, very thin muscle. The muscle is much thinner and much weaker than your skeletal muscles. What is affecting these muscles is the estrogen effects. So estrogen is very important in supporting the pelvic floor, in supporting the vaginal tissue. Skin collagen, estrogen plays a big role. And that is not the skin just on our face. It's also the skin and mucous membranes in the vaginal area. Estrogen increases the blood flow to the skin, to the mucous membrane, which leads to more hydration of the skin. That's why in patients, when they're perimenopausal or menopause, their estrogen decreases, there is less hydration, which leads to thinning of the tissue and frequent bleeding because of the dryness. Also, because of loss of collagen due to lack of estrogen, we are going to see loss in the elasticity. So that's why most of the symptoms with the painful during intimacy, bleeding, or loss of sensation is an effect of estrogen. So we as women, we lose collagen as early as age 30. So it starts in our 30s actually. And the loss is about 1% of collagen per year, as I said, starting in your 30s. Collagen is important. Collagen is important everywhere in the body. We have collagen in our skin, we have collagen in the joints, we have collagen in different organs, and we have collagen which plays a big role in pelvic floor. So the collagen is responsible for the firmness of the skin. So whenever the collagen goes low, you're going to see laxity of the skin everywhere in the body. And organs of the pelvic floor, including vaginal walls. It leads to decrease in the elasticity of the vagina. It also affects the support of the pelvic floor connective tissue. That's why you're going to see a lot of symptoms of pelvic floor dysfunction after menopause or during perimenopause and even in 30s. So this decline in collagen can lead to, and usually leads to, wrinkles. We see it on the face all the time, decreases laxicity of organs, especially when we are talking about pelvic floor, we're talking about vaginal laxicity, and it increases tissue fragility, as I explained, dryness, dehydration, decrease in collagen, all three of them are going to lead to increased risk of vaginal bleeding with intimacy or sometimes without even intimacy. Patients I see all the time after menopause are going to come because they had spotting. The spotting is because of decrease in elasticity and because of decrease in collagen. Of course, postmenopausal bleeding should always be taken seriously and should be evaluated by a gynecologist because it's not always collagen loss. Other serious conditions should first be ruled out. Next slide, please. So as the estrogen goes down and with aging, the skin gets thinner, the skin gets drier, and it's slow to repair. So if you look at a young baby, let's look at babies who are 3 to 6 months old. If they scratch their face with their little nails, you'll see within 24 to 48 hours, the scratch is gone. The skin is perfectly healed. Versus patients who are older, even in 30s and 40s, if you get a little burn while cooking, you will see it takes a long time to heal. And if you see women or any patient who are in their 60s and 70s, their risk is even higher, that the wound healing is longer, higher risk of infection, and all of those are because of the changes we talked about. With aging, the muscle mass physiologically goes down. That affects the muscles everywhere in the body. That leads to decrease in energy. That's why patients feel fatigue all the time. The weight distribution changes. With aging, we something called central adiposity. That means the weight around the waist. So there is a more tendency of gaining the weight around the waist, which is around the waistline, which is actually the most dangerous weight when we look at the studies for cardiovascular health for women and for men actually. So the weight around the waist is something which is more dangerous. Estrogen plays a big role. Women's cardiovascular risk is much lower until menopause. After menopause, we actually reach the same level as men. That is because of the estrogen's effects and cardioprotective effects on the health. But weight distribution changes with aging. So these are the changes which are measurable and they're treatable. There are things which can be done about these changes. So let's talk about 5 symptoms which women ignore. These are the symptoms I see in my practice all the time, and these are common symptoms, but that doesn't mean they're normal. But these are the symptoms which are asking you that your body needs support. These are the symptoms where we need to talk about self-care, where we need to talk about right medical care on right time. So the first of them, the most common one, urinary incontinence, which is leakage of urine while a woman is trying to go to the bathroom and her bladder is not even completely full. It's not that she hasn't peed in 4 hours. It's not that she drank 2 big bottles of water. It's simply she didn't even know that her bladder was full, and it is usually not very full, and she's sneezing, coughing, or laughing with friends, or jumping on a trampoline with her toddler, and all of a sudden, there's leakage of urine. And why is that happening? One of the reasons we talked about, pelvic floor muscles. The muscles are weaker. The tissue changes because of the lack of the estrogen or decrease in the estrogen, the tissue is changing. Thirdly, there are different shifts in the nerve coordination. A lot of this could be happening due to the trauma of the pelvic floor during deliveries. We see it more common in patients who have diabetes, but there could be other neurological factors such as patients with connective tissue disorders or neurologic disorder. Now, leakage of urine or urinary incontinence is a treatable condition. There are different treatment options. Second symptoms, common pain with intimacy. And many patients will think, oh, it's usually in women in 40s and 50s. Believe me, it's more common in any age. We see this in patients in 30s. We see this in patients in 60s. And why is that? One of the reasons for that is lack of estrogen. As I said, in 30s, the estrogen starts to go down. Of course, there are more psychological factors which play the role, but today's talk is mostly about the medical evidence between the hormones and the pelvic floor and what can be done. So for the purpose of this talk, we're going to talk about more measurable causes. So one of them is lack of estrogen. Secondly, the thinning of the tissue with aging. And again, estrogen plays a big role. Remember, it hydrates, it helps with the collagen production, it increases the blood flow to the organs. Thirdly, decrease in lubrication because of the similar reasons, the dehydration, the drying of the tissue. Now, painful intimacy is not something which must be tolerated. There are treatment options. Patients need to speak about it. Providers need to hear about it, and they need to work together to see, because this is not normal. Third one, vaginal dryness. Because of reduction in the levels of estrogen, there is decrease in collagen hydration, which leads to less moisture, decrease in the blood flow, which can lead to vaginal dryness. So it is definitely, many of these symptoms are connected to each other, and many patients will have more than one actually. And what does that impact when it's a vaginal dryness? Comfort. Vagina is an organ which is supposed to be lubricated and hydrated. Think about it. If your mouth was dry all the time, how would you feel? Not very great, right? So similarly, vaginal dryness is very, very uncomfortable for the patients. Secondly, confidence. It affects the woman's confidence. It affects their mental health and quality of life. Many women are working women in their 30s, 40s, 50s, and even 60s. Vaginal dryness is not comfortable, and that can affect the quality of life. Similarly, if she's working or traveling or just having fun, going for a run, going for a walk, vaginal dryness can be very uncomfortable. Now, there are different support options which exist for the vaginal dryness and for its treatment. Next thing, pelvic pressure. Remember, we briefly talked about pelvic organs, vaginal, which is uterus, bowel, and other organs of the pelvic floor. As they come down, it can cause pelvic pressure. That can lead to symptoms of heaviness, pressure, and sometimes patients just don't feel normal. I get the question all the time. It's like bulge in the vagina. It's all the prolapse of these organs coming down. In the cases of pelvic pressure, timing of treatment is the key. Early intervention can make a big difference for these patients. Now, let's talk about sudden skin aging. This is very common. Most of the women are going to see a significant difference from 20s to 30s, and definitely a big jump from 30s to 40s when their skin feels different. They just can't moisturize it enough. It feels dry. There is changes in the skin textures, more increase in the wrinkles. Why is that? Decline in collagen, normal with aging. Like I said, about 1% collagen goes down every year after age 30s, and the loss is much more accelerated even in late 40s and then 50s. Hormone shift. Estrogen plays a big role for the laxity of the skin, for the youthful appearance of the skin. And then the third thing is skin turnover. Our skin is always what I call a sloughing, and that's very important. The top layer of the skin, which is the dehydrated, the dead skin cells, they need to be sloughed. The sloughing is much faster in the younger patients. As we get older, the skin turnover is decreased, and that's where our tretinoin comes in, which helps with the skin turnover. There are evidence-based treatments available which can help with the stimulation of the collagen production, with hydration, with decrease in wrinkles, and with just healthy aging. So what are the treatment options we offer here at Mirac Wellness? So that can work for you, that are good options for you. So the treatment options we work on and which are available to our patients are basically designed for restoring. Again, we're not chasing youth. We're just trying to restore the functionality of the pelvic organ, of the skin, and for the overall woman's health. We have treatments which will help with tissue health. We have treatments which will help with muscle health, because remember, these are layers of the pelvic floor. There is muscle, there's collagen tissue, and there is connective tissue disorder. And at the cellular level, it's collagen production. So this is all about functional medicine, what we can do to improve patients' health and to improve these symptoms. So let's talk about collagen production. What are the treatments? There are a lot of treatments available. Microneedling is a non-invasive treatment. How microneedling work? These are hypoallergic, gold-plated needles which go into the skin. It's very important the person who's doing the treatment knows the anatomy of the skin, needs to know where those fibroblasts, the cells which are responsible for collagen production, live. So you give a deeper microneedling radio frequency in this level at the skin, they start producing collagen. Remember, the collagen production goes down. So these fibroblasts are almost like in a sleep mode. When we kind of wake them up with deeper microneedling, they start the collagen production. Secondly, the deeper microneedling, when you use the energy and the radio frequency, it also helps with the firmness. So it's producing the collagen, decreasing the wrinkles with the firmness. It improves the texture of the skin. We see it all the time, that the skin is more hydrated, the skin's texture is better, because again, the science behind it is when there is more collagen, there is more hydration, it is going to lead to better texture. There are medical grade retinoids which you can get from your physicians or your healthcare providers. These are medical grade products, and they have a perfect percentage of vitamin A, which is retinoid, which is important for cell turnover. Remember, I told you that the cell turnover goes down. The skin is not sloughing as it's supposed to. That's why the deeper layers are kind of, hiding back in there. So for the cell turnover, it's important to have retinoids. I tell my patients in their 40s, I'd recommend at least 3 to 4 times per week use of retinoids. And very important, the next day after retinoids, to put SPF, strong SPF, and avoid direct sunlight as much as you can, because retinoid is going to increase sensitivity to your skin. So increased risk of sunburn, increased risk of damage to the deeper layers of the skin. So it's important to use retinoids carefully and under medical supervision. There are also treatment which will help with the collagen production. So for restoration, a thorough medical examination is very important, especially when we're talking about pelvic floor, a thorough examination by a gynecologist to really see, because it's not one size fits all. Different patients can have damage at different levels. Sometimes it's more of a muscle issue. Sometimes it's more of a collagen issue. So each patient is different, and the treatment needs to be individualized for each patient. We usually start with each layer. So you can't just, if a patient has a damage at different levels, you can't just treat collagen and leave the muscle alone. Remember, I said MRI studies show some damage to the muscle. We cannot bring the muscle right where it was, but we can restore it. It's same thing like having a sports injury, right? Even if it's a damage to the muscle, doing a physical therapy and treatments can bring that muscle mass back. We can do the same on the pelvic floor. So pelvic floor restoration is just as important. So we can strengthen muscles of the pelvic floor. We can help with the structural support of the pelvic floor. And main goal here is to restore the functionality of the pelvic organs. Remember, it's a functional organ. Now, also important to check the hormones. Patients who are feeling these symptoms, it's not just one treatment. We will usually like to check their hormones with that. Make sure their estrogen levels are not too low. Yes, most of the time, just doing one blood test may not be sufficient. You may need to do more than one blood test. There could be a hormone imbalance where hormone replacement therapy, along with other treatments, may be the right option for the patient. This is a proper medical care for a woman's health. It's not just, one thing. We have to restore the damage which is done, or we have to restore the changes which are happening with the aging. We're not trying to reverse them, but we are trying to restore what we have and make it more functional and increase the wellness for our patients. So what are our long-term support? Our long-term stroke, we want to have the strength. So the strength training of the pelvic floor, Or for a woman, for her bone health, whenever I see patients for weight management, for hormone replacement therapy, my first thing to tell them is two things most important: protein intake in your daily life and weight-bearing exercises. More and more studies show it's important for bone health. Same thing, strength for pelvic floor is very, very important. Like I said, protein, and you don't need to go buy any fancy protein. The basic protein, which we have been eating for hundreds of years, works just as well. Yogurt, peanut butter, meat, eggs, chicken, fish, all of those are great sources of protein. Hydration, can't emphasize enough, hydration is the key. Drinking adequate amount of water, staying away from sodas, and definitely using very limited amount of alcohol. There is more and more data showing what are the side effects of alcohol. Skincare products, very important to have medical grade skincare products, because when you buy medical grade skincare products, they have, if you look at the bottle and it says 1% tretinoin, you're going to actually get a 1% of vitamin A in it. So medical grade products are the key, because that way you know what you're putting on your skin. So all these tools are there to support the tissue health, and medical grade skin products are going to support the tissue health at a cellular level. They need to be used continuously, regularly, at under the guidance of a healthcare provider. Please feel free to ask any questions. There is no silly questions. There is no embarrassment. So if you have any questions, I'm here. I think I see a question. Not sure if covered, but does it matter how far postpartum you are? Yes, it does matter. So body takes about 6 to 8 weeks to kind of go back to pre-pregnancy state, especially when I'm talking about pelvic organs. The actual recovery can be up to 1 year. But for postpartum pelvic health, when we are evaluating the pelvic floor, ideally about 8 weeks is a good time to have a thorough pelvic floor examination to see what are the changes and what can we do to restore the function again. I hope that answers the question. So the question is, does pelvic floor therapy or pelvic therapy hurts? Actually, no, it's a completely painless procedure. There are different options. The one where we are developing the muscle is not painful, and we gradually increase the strength for the muscle exercises, so it's well tolerated. And there are other pelvic floor therapies where if we need to use needles, we will give enough anesthesia. So we usually book this appointment for about hour and a half. So there is plenty of time for anesthesia, and we only proceed with the treatment when it's completely painless. Most of my patients, as I'm doing this treatment, they're actually on their phone watching YouTube or answering emails. So it's not painful. Yes, great question. Can pelvic floor therapy help with perimenopause or postmenopausal people? The pelvic floor therapy is actually perfect for perimenopause and postmenopause people, especially if there are patients who don't think that hormone replacement therapy is the right option for them, or they're not candidate for hormone replacement therapy because of risk factors. And we can have another talk all about those risk factors one day. But for those patients, pelvic floor therapy is the best option, and it can address different problems like those 5 points I talked about: urinary incontinence, um, painful intimacy, dryness, feeling bulge in the vaginal area, prolapse. So it's a great treatment for those patients. Follow-up care after therapy, very good question. So most of the patients can return to work next day or same day, depends what treatment is done. Most of the time, we recommend them for next 4 to 6 days for complete pelvic rest. Also, natural vaginal mucus is a very healthy treatment. So we recommend about 4 days after that, no baths, but they can shower. Limited exercise for about 1 to 2 days. And otherwise, they can go back to work next day and they can restore most of the functions between 3 to 4 days. What do we do in pelvic floor therapy? Depends what we are treating. So if it is a muscle issue, mostly we will be performing a treatment called V-tone or vaginal tone. It's a small device which goes into the vaginal canal. It's connected to the machine, which is a FDA cleared treatment. We start the strengthening of the pelvic floor muscles. It's squeezing it slowly, and it exactly goes to where those pelvic floor muscles are. So it's a very controlled device. And then it's treating those muscles by slowly increasing the contractions in that area. We actually control it from outside, depends upon patient's comfort. Most of the patients will be able to tolerate more with each time. It's like going to the gym. First time, if you were able to do dumbbells 10 pounds, you increase slowly to 15 and 20. You don't just start lifting 50 pounds. So same thing we do for pelvic floor. Then there is a treatment called Forma-V, which is important for collagen. So like earlier, there was a question for patients who are menopausal or perimenopausal or immediately after delivery, when there's a lot of dryness in the vaginal area. Forma-V is a great treatment option. It's non-invasive, no needles, no pain, no anesthesia required. It's a very gentle heat with radio frequency. It's done over about 20 minutes. When we put this very small, thin, it looks like a vaginal probe for ultrasound. It goes in the vaginal wall, and we treat all the vaginal wall for about 20 to 25 minutes. Very, very comfortable treatment. And then the third one, if we are trying to treat the prolapse, which also increases collagen, is the procedure we call Morpheus V, which is the same Morpheus treatment you have heard, which is done on face for skin tightening, wrinkles, but the goal is a little different in the vaginal area. Where it goes, first we give anesthesia to the patient, local, just gel for about 40 minutes. And after that, the treatment is done. It's deeper microneedling when we go all around in the vaginal area. And it takes about 40 minutes to do that procedure. Is leakage normal after childbirth? Leakage is normal after childbirth, but only for few weeks. And the pathophysiology for that leakage is completely different. Most of the time, it's the discomfort and the pain, especially after a vaginal birth. But leakage of urine after childbirth, which persists after 6 to 8 weeks, is absolutely not normal and can be treated. Does holding urine strengthen the pelvic floor? Holding urine, if you say just during the day, no. But there is a treatment called Kegels exercises, which is the way I tell my patients how to perform that exercises. They go sit on the toilet seat, start urinating. As soon as they start, within 5 seconds, they are going to hold the urine. And it's not holding urine, which is actually the treatment. It's strengthening those pelvic floor muscles. So just holding the urine by itself during the day that, oh, I should just wait for another 30 minutes, it will make my pelvic organs stronger. Answer is no. But holding the midstream urine by tightening your pelvic floor while you're urinating is a part of Kegel exercise, and it works great. But if the patient is already symptomatic, just doing Kegels may not be enough. They need treatment. And after treatment for a maintenance therapy, Kegels is a great exercise. I hope that answers the question. Is it too late to start treatments at age 55? No, it's not. It's never late. I have patients who have come to me for treatment and they're in their 60s and had great outcomes. So there is never too late to start treatments. Well, thank you so much for everyone for attending. And if you have any further questions, please look forward to our next seminar. And I look forward to hearing back from all of you guys. And thank you very much for your time. Have a great evening.